Right, let's head now to the Eastern Cape, where orthopedic surgeons at Livingstone Hospital are unable to perform vital hip replacements and other operations because the health facility has run out of metal implants. So frustrated have the doctors become, according to an article in the Daily Maverick, that they're now giving their distressed patients letters warning about the situation and that it may impact their recovery. The letter goes on to list 3 numbers patients can call. Now, among those numbers, the presidential hotline. I'm joined now by Dr. Mthandeki Xamlashe, Deputy Director General in Clinical Services at the Eastern Cape Health Department. Doctor, thank you so much for joining us. This is really a very troubling situation. I just want to know, first of all, are you going to be taking action against these doctors over the letters they've sent out?
No, at all, not at all. Thank you for having me, and good evening to your listeners. No. We're not there yet. Our focus is on saving lives. That has not changed. Our oath has nothing to do with some of the behaviors that are now that are happening in our facilities.
The reason I'm asking,
we're dealing with the issue of backlogs. The issue we're focusing.
Let me just quickly go back to the letter given out to patients. I just want to be absolutely clear. Will these doctors face any potential future action for this letter?
The letter that you are referring to is not in my possession. I have heard about it. It has never reached my desk, and we don't consider that letter to be part of the legal file of a patient, which is our only reference for our interaction with our patients. So anyone who puts their opinion, an advert, or anything in that legal file is acting outside of their scope of practice. There are authorities to deal with that, not me. There are powers and regulatory bodies to deal with such issues, not myself.
So let me understand this. Does that mean that they might face potential action for what they've done, but not through you?
No. People are only taken into task if they violate regulations. If they had violated the POPI Act, if they violated National Health Act, only then will people such be taken on. But I have not seen the letter. As I say, it's not in my possession, so it's just a speculation, and I'm not prepared to get into that area. I'm talking here under oath. I'm
with you. So you are actually the former CEO of this very hospital, Livingstone Hospital. You're on record as saying in December 22 that there were over 100 patients waiting for surgery. So you're obviously well aware of this problem. Just talk to me about why there is a situation where patients desperately in need of orthopedic surgery are unable to have those operations because of this implant deficit.
Yeah, maybe to simplify a very complex subject, there's 2 aspects to orthopedic backlogs. We're talking about bone operations here. There are those that are emergency, like someone who was involved in a car accident. Even among those ones, there are those who have life-threatening bone injuries. There are those who have what I would call non-life-threatening bone injuries within that same category. And then you have other people, sometimes because of old age, and your hip or your knee, has a bit of wear and tear, and therefore it needs to be replaced. That causes a lot of pain, but it's not life-threatening. But that's also a priority. So when you talk about backlogs, we're talking about those 3 categories. Because of the high demand for trauma orthopedics, in other words, what is called emergency orthopedics, they then take up a lot of our resources because they are life-threatening. And they are always considered P1, priority 1 by the system. But because they keep coming in big numbers, they push back these other poor categories of patients who have a very painful hip that needs to be replaced. But unfortunately, it's not life-threatening. So when my teams and my doctors have to triage patient, they'll always go for the ones whose life is at risk because of the injury. So that's how the backlogs come about. I'm aware of it. You're right. It was 100 at the time I was at Livingstone. And I can tell you now it's sitting at 60. And it's slowly going down because of the efforts of those teams on the ground. So my relationship with those teams on the ground is about around the good work that they are doing, despite all the challenges that they are confronted with.
Okay, now I understand that. Obviously you have to deal with a person who has an immediate threat to life. But surely that's where planning comes in. As a hospital, isn't there a plan made saying, look, we get a lot of road accidents, we have a lot of people who may need this. We can't always predict it, but you have to have a certain cushion of those things. How long has this been a problem for? I mean, are we talking a few months or are we talking a few years?
We're talking a few years in orthopedics, and we're not talking Livingstone. We're talking the whole country. So orthopedics is a highly specialized service. It's not a general service. It's highly specialized. Number one, the country doesn't have enough orthopedic surgeons to deal with the demand for the services that is out there. Fortunately, you are exactly in that space. You report on accidents every day in your news bulletin. That's what's happening. So the demand is pretty high, and therefore the resources are really constrained. And remember, there are 4 factors that drive, the backlogs. Number 1 is the demand for emergency orthopedic. Number 2 is the theater time, because it's not only orthopedic patients that need theaters.
Sure.
There are other emergencies, pregnant women, people who have got stabbed abdomen with their bowels hanging outside. They also have to compete for the same theater time. Number 3 is personnel, not just doctors. Nurses are very critical, specialized nurses in orthopedics and specialized nurses in theater work. Porters, admin clerks, cleaners, everyone has a big role to play, rehabilitation teams. You need that comprehensive package of personnel in order to deal with the backlog. Then the issue of implant availability is actually number 4 in terms of weight on these 4 factors. And the country is not yet short of those implants at all. We have got good companies that are always having those implants available to us. The issue of account backlogs are matters that we are resolving from time to time. They have never been really the reason for the backlog. I can never blame our suppliers at all, despite us at times owing them significant amounts of money. But they've never really totally blocked our accounts. They've worked with us throughout. But the main thing is the high demand.
Yeah. I understand. Again, that points to, you're saying that there are factors. There's just not enough orthopedic surgeons, not enough theatre time. But clearly these doctors are used to these constraints. The fact that they've got to this level means that things are really, really bad. Talk to me about timeframes then. How soon is this going to be dealt with? When is this going to be sorted out?
It's being sorted out. We started work on this 2 years ago. That's why we're talking 60 now instead of 100 people waiting. What the department has done, number 2, it has added more theatres to Livingstone specifically, if we're to confine the discussion to Livingstone.
Got you. So how long then, sorry to cut to the chase, but just we're running out of time a little bit. Someone with a non-life-threatening but extremely painful requirement for a hip operation, how long are they going to wait before they get a slot in Livingstone Hospital currently?
The theatres, as I'm talking to you, are now completed. They're being commissioned. Okay. By 1st of April, the theatres will start operating 24/7 so that they can actually be able to deal with the backlog of other people.
So how long will someone wait?
By the 1st of April, these
that's when the
theatres will start working.
Okay, so how long is someone going to wait for a hip replacement?
Procedures, I'm not going to lie to you. The waiting time for these procedures is about 3 to 5 years across the country. But we are going to do everything we can to open more theatres and open more theatres in other district hospitals to deal with the cases that you are referring to, the implants and the arthroplasties, your hip replacements. And as we do so, we are also going to be bringing in other private practitioners in the orthopedic space to assist us. So it's a project put in place to try and reduce that waiting time from 5 years to 6 months. It's not going to happen overnight. It's going to take time. It's an expensive procedure and it requires specialized skills. So I'm not going to lie to you and say, you look, in no time, they'll be waiting for 5 days. Not at all. For in the next 2 years, we want to reduce that waiting time from 5 years to 6 months for the non-emergency or non-life-threatening operations. That's our target.
All right. Well, thank you so much for speaking to us this evening. That's Dr. Mthandeki Xamlashe. He's Deputy Director General in Clinical Services at the Eastern Cape Health Department, explaining the complexities of getting these implants into patients' bodies. It's not just about the implants themselves. There's not a lack of availability, but he's detailing a myriad problems. He says they've got a plan and they've got a time frame.